What's up, people? Welcome back to another episode clip of Pree Da Podcast. Just a reminder that these are only the shortened clips, and if you want to listen to the full episode, make sure you click the first link in the description below, or alternatively, you can type in Pree Da Podcast on all your audio listening platforms. And without further ado, I'll catch you guys on the other side.
I forgot where I went the other day, and I was like, oh, I'll have like a medium drink. A large. And she was like, are you sure? And she pulled out this massive 1 liter.
This has got to be the biggest Shirley Temple ever. This thing right here. My goodness.
You are now listening to Pree Da Podcast with your host, Majaro.
What's up, people? Welcome back to another episode of Pree Da Podcast. You guys know what I'm going to say? Make sure you like, comment, and subscribe, because we're trying to build a community here, and by sharing this with your friends and family, that goes a long way in helping us do that. And without further ado, let's get into it. Welcome, people, to another episode of Pree Da Podcast, episode 8. And today, as you can tell, there's no one beside me, but I guess you can tell by the title, this is a very special episode. I've got someone with me from the family tree, the old bloodline, the tribe. I've got someone very special. It's Topeeeeee! Hey, how you doing, Topeeeeee? How you been?
I'm good. How are you?
I'm good. Just to give everyone a backstory, me and Topeeeeee are cousins. Well, my mum and her mum are sisters. So that's how we relate to each other. She lives in Maryland, DC. But, you know, you can't like to call it the DMV area?
Yeah, we call it the DMV. Just some lingo, just think when you come back and visit.
Yeah, me and my family visited a couple of years back before COVID. So, you know, that was our first chance to meet each other properly. And then we met over in Canada again. And that's how, you know, we linked up a bit more and started speaking more. So you finished college and, you know, you've entering the final stage of medical school. What made you, you know, pick the role or pick the career path you are on now?
So I've always wanted to be an OBGYN. Oddly enough, like I knew.
Wait. Just for the people, you coming out with a lot of acronyms. Just for the people, what is an OB?
GYN? I think you guys call it obstetric.
Gynecologist.
Yeah.
Okay, so you're a gynecologist then?
Yeah, I'm a gynecologist, which is, I don't know. Yeah, you're right. Did you know grandma was a midwife?
Yeah, I knew.
I literally found out like maybe 5 years ago when they were like, oh, is that why you did it? I was like, I had to know.
Yeah. Come on. It's a bit obvious. How many members of our family tree on our mum's side are doctors? Loads of doctors or working, you know, or nurses or like gynecologists. Like it's even my sister is studying to become a pharmacist. So the medical science, in the University of Liverpool. So literally medicine is in the bloodline for sure.
It is. I had no idea. Shout out to Tolu, our cousin, who just finished his residency.
Oh, finally! Well, he's been forever in Philly. Like. Last time I spoke to him, I was like, oh, so you still in Philly? Like, he's been there for 3 years. 3 years.
Yeah, we went up there last week for the graduation.
Oh, wow. I need to see the pictures for sure. You got to send me them after.
Yeah. Shout out to Tolu. So I've always wanted to be OBGYN. And I think a lot of it is growing up in an African household, at least mine. My parents did not talk about what it was to be a woman. And so this was my way of like going, like, I need to find out what it is. So that's why women's health has always been important because, I mean, I don't think my story is unique. There's a lot of people who don't talk about like what it is, reproduction, like all that stuff, menstruation, everything. Like no one's talking about it. So it was really important that I go into that field. And so that's why I chose OBGYN.
So you mentioned, obviously, you know, health and eating. As an OBGYN, do you think there's a direct correlation with the types of stuff you consume and a female's, reproductive health?
Yes and no. So and I don't want to say that they're not related. They are, definitely. Unfortunately, like in our curriculum, the way we're taught, it's not integrated. So like we as in our residency, which is when you do your specialized training, we talk about it, but in the context of primary care. So like when we're taking care of women with high blood pressure or diabetes, yes. But we don't integrate those principles when we're talking about like why your menstruation might be off or
really?
Like, infertility is not part of a conversation. No.
Do you think it should be? Because I feel like
there's so many things now that I've gone through, like in terms of like just practicing, that you realize is missing from medical education and training, and nutrition is definitely one of them.
Wow, like
yeah,
definitely. And
I mean, if you really think about it, like it's such and this is why I guess you might not see it over in England, but over here, there's a lot of conversation about like reform in terms of our education and making it equitable and making it more comprehensive as opposed to just concentrating on like
fixed
uterus.
Yeah, like, fixed areas, and you're in a little silo doing your own little job. And this is like your body, and you're not talking to the other functions of the body, and you're ignoring other factors.
Exactly. Nail on the head. Exactly. Like we're so siloed in our profession that the cardiologist is doing only this and doesn't relate to that. And this is the reason why you're having that issue. And so there isn't like any comprehensive healthcare. And then that leads to healthcare issues because we don't know how to have those conversations.
Yeah, I feel like that's one of the things that's glaringly missing in the American zeitgeist. It feels like health in terms of just general, and we're not talking about going crazy in terms of fitness bodies and being an IG model, but just the simple, use your carbs, the greens, you need a healthy balanced meal. Yeah. Like it's not that. It's very much have whatever you want, pleasure, shows of food, man versus food, crazy amounts of plate size. Like it's crazy. I feel like that's literally dramatized. Like it's not like everyone's trying to keep control. We all know about the portion size at McDonald's and KFC, and it's crazy. Do you feel like that is a self-perpetuating cycle in terms of people seeing these foods online and in their face and adverts, and then eating them, and then health problems, health insurance, and costing, everything just keeps on going up.
Yeah, no, absolutely. Because a lot of those things are tied into like when people talk about like, especially areas of like poverty. Like, so like if you think about it, so like there's a salad place that I absolutely love, has great salads. But it costs more to eat well than it does to eat poor, right? So, I mean, yes, I can make a salad, but I feel like my salads wouldn't be great as this place. But it's like $15, right, for a salad.
That's a lot.
I can easily go to McDonald's and get a meal for under $5. That includes like a drink that can last me days.
Oh, wow. Days. Drinks for days.
Oh, have you seen like the large? Like I forgot where I went the other day, and I was like, oh, I'll have like a medium drink. A large. And she was like, are you sure? And she pulled out this massive 1 liter.
This has got to be the biggest Shirley Temple ever. This thing right here. My goodness.
From McDonald's?
It was another takeout spot. And I was like, can I have a large? And the large is like almost 24 ounces. That's a liter of soda.
Wow.
Like a big, like, and I was like, oh my God, that's a lot. And she's like, yeah, you might want to try the medium, which was equally as much, but not as.
Oh, equally as much? Yeah.
It was a lot.
These guys, I mean, obviously economies of scale, like they bulk buy those stuff. That's just capitalism 101. So
it's so much easier to eat like not good, like not to eat well than it is to eat well, right? And then when you think about like like if you go into different areas, we call them like food deserts. There might be an area in DC that there's no good grocery store. Like you just have corner stores or bodegas, what we call in New York. And then like several fast food places. And so like you don't have that many options. You don't have the opportunity to eat well. And so when we talk about inequities or disparities in health, like that contributes to it, because the way the cities are planned, like you can't get like a really nice salad place to go into like a poor neighborhood, but you can get McDonald's in there and then you're feeding your whole family for less than $20. But then there's also no grocery store for you to be able to make reasonable choices or nutritional choices for your family.
Because they're so far away or something.
It's a cycle. It's a very vicious cycle. And so, you know, I think whenever we think about solutions to like, how do we correct these disparities in health, like it can't just be like one single solution. It has to be a whole comprehensive plan in terms of how do we improve our school systems? How do we improve the neighborhoods? How do we improve nutritional choices? How do we provide access to health? Like all of those things contribute into that.
And all of those things equally need to be fixed. So it's not a one stop.
It's not a one size fits all solution. Yeah,
it's not. Wow. Yeah, I could really imagine being in that vicious cycle. Like, because obviously life takes you. You know, you can go from 0 to 100 real quick. You just don't have the time anymore, like you used to. Like, you know, you might have a kid, and now you can't afford to spend 20 minutes going to the grocery store. So you might just, you know, pop up to the bodega and get something real, you know, quick and easy to put in the microwave, and Bob's your uncle.
Yeah, it's so easy not to like take care of yourself. You know, like I mean, if you really think about it, like if you're living like a default setting, right? Like I'm gonna live where it's cheapest. I'm gonna eat what's like cheapest. Then like all of those choices kind of lead to like a poor outcome.
Yeah, poor quality of life for sure.
Yeah, absolutely,
definitely.
Like I'm privileged because I'm like I could get a gym membership. Like, you know, when we were like when we were talking, and I was like, yo, I got to go to the gym real quick, and then I'll hit you up in like an hour. Like not many people have that option or that privilege to be able to like take time in their day and concentrate only on themselves, whether it's an hour or not, just to keep physically fit, you know?
Yeah. So poor health choices lead to poor health, and poor health leads to, you know, conditions, whether it be diabetes, heart problems, obviously if you're a chain smoker, lung problems, and all those conditions lead to, you know, increased health insurance. And the way health insurance is it's a bit foggy to me. Like, could you give me like I wouldn't say like a simple, because I know it's very complicated, because, you know, you can get your work to, you know, contribute to your health insurance. You can go without health insurance to take all the costs up front, which sounds crazy to me, because I'm seeing, you know, 2.5 grand to deliver a baby. I'm seeing 500 for the ambulance or whatever. I'm seeing, you know, for an ankle surgery, you know, 11,000. Like all these numbers are crazy. So if you were to give someone advice on insurance in America, how would you go about doing it? Would it be like the cheapest option? GoCompare.com or something like that?
So it's so crazy because I think insurance is a very complex issue.
Yeah. I'm not expecting you to have all the answers for me. Like, don't worry about that.
And I don't have them, because that's also something that they don't really teach you in medical school. Like,
I swear. I thought that'd be like hand in hand. Like, okay, so if you really want to get the money in or something like that.
No, I mean, you heard bits and pieces of it in terms of like this might not be covered or this is covered, but you're not really taught about the business of medicine in medical school, unfortunately. So then like you don't even realize until you're in it, like how much you contribute to like that disenfranchisement of certain populations because of it. And then like I've had people come into me like, oh, I got this bill, and I'm like, stop right there. At front desk. I don't talk about money. It's. I mean, we're taught that it's unsavory, right? Like it's really uncomfortable for you to come to me and talk about this bill because I didn't give you the bill. So what I can say is I can kind of give you a quick overview of some healthcare landscape and insurances, right? So you have your employee sponsored insurance, right? And so there's different health insurances within like United States, and there are even different ones within your state. There's some health insurances that exist in Maryland that don't exist in DC. So it makes it harder if you cross state lines, and considering how DC, Maryland, and Virginia are close, which makes it really crazy because like I'm a mile from the DC border, and depending on your insurance, I might not be able to be covered if something happens to me 1 mile from my house.
Yeah.
Right?
I've heard of those scenarios. It's actually crazy.
Yeah. It's crazy. So then you have, let me take it a step back. So you have MCOs, which are, oh my God, I'm blanking, managed care organizations, right? And then you have ones that are sponsored by the government. So everyone knows Medicaid and everyone knows Medicare.
Is that Obamacare?
So Obamacare is not the same thing.
Okay.
Obamacare extended coverage for more people.
Mm-hmm.
So Medicare is like if you're elderly or disabled, you're covered by Medicare, right? So let's say you're 5 years old and you have some debilitating condition. You might be covered by Medicare because you're considered disabled, and so you'll always have insurance. If you are 65 and older because you are no longer in the workforce and probably not getting a job covered insurance, then you're covered, right? So that's Medicare.
Okay.
I remember someone told me like an acronym that's like care for the elderly and aid for something else. I can't remember. If you want to remember it. But Medicare is for the elderly and disabled. And then Medicaid is the government sponsored insurance, right? So that's eligible to anyone if you don't meet requirements, like either for your job or you decide not to cover, like do your job, sign up for your job. But those do have income requirements, right? So in order to get the government sponsored one, you have to either be making below the poverty line for the government to now subsidize your insurance.
So that's just based on your incomings?
Based on your income.
Not outgoings, because, inflation be crazy right now. So your salary could be stagnant and healthcare or health insurance goes up and electricity goes up, but you're still going to get the same fixed amount of allowance or whatever it is.
Well, like you just sign up for it, and then it's almost kind of like car insurance, depending. It's so complicated.
Yeah, it's fine. It's fine.
Yeah. Because I'm trying to think. So, like, let's say you are fresh out of college and you join like this job, like let's say like a nonprofit or a startup, like you and your boy, like, yo, we're going to start this company together, it's you and him. And it's small enough where you are not required, because there's only 2 people in the company, you're not required to provide health insurance because they have laws. Like if you have a company that has more than X number of employees, you are required by law to provide them an option for health insurance. So if you are under that minimum number, let's say you and your boy have a job, you're like, all right, it's up to me to find health insurance for myself. So like you go onto like a marketplace, it's basically a website, and then you basically put in like all your stats, like I'm healthy, and then they give you how much it costs for you to get health insurance. Okay.
Oh, so yeah, like you said, like, compare the market.com.
Yes. I can't remember what, so every state has that, but the premiums are so much. That's the problem. That's why a lot of young people don't sign up. So like you might find like a really good insurance, like there's so many, like a really good insurance, and it's like you have to pay $700 a month.
Right. That's
right?
70. What?
So you might have to pay $700 a month, and then you might have a deductible, meaning that, like, I don't know if you know what deductibles are, but basically a deductible is like you have to pay this much. It's like cost sharing. You have to pay this much of the insurance before we actually kick in.
Oh.
So not only do I have to pay $700, you might have a high deductible of $10,000. So now I have to spend at least $10,000 for now my insurance to kick in and start helping me make payments.
Wow. Yeah. That is complicated.
So if you're relatively healthy at 20 years old and you just want to get like a regular annual checkup, you're paying $700 just to have the card to go to a doctor's office. And let's say that whole visit is like $1,200. You have not reached a deductible of $10,000 for your insurance to kick in. So you still are on the hook.
That is crazy.
For that $1,200.
There's
some people are like, well, what's the point?
Yeah, that's what I'm thinking. What's the point if I need to... The cost needs to be over 10,000 for me to get any help. What the hell? Yeah. So I'm literally eating the data or the lower end stuff. If I'm relatively healthy, what? So so you're saying there's more of advantage of me, you know, getting in a car accident or something like that, and then paying out, you know, over 10,000, than for me to, you know, get a sprained ankle and just have it to be like what, I don't know, 2,000 or something like that. That's crazy.
I mean, so that's the thing. Like, it's almost like car insurance in a way. Like, you paying all this money for the eventuality that something's going to happen that you're going to require it, right?
Yeah.
If you're relatively healthy, and you're paying like $700 a month. There's 12 months in a year. What does that come up to? Like $5,600 that you're paying, just for like an annual visit. So like a lot of people just don't go and get health insurance, right? So, but if you get into a car accident and now you're in the hospital. And like you're in the hospital for like 5 days, you have to have surgery because you've made that choice not to have insurance, and you get that bill for like $100,000.
Oh my God!
Oh, wow.
Right? As opposed to if you had the insurance after $10,000, like the insurance would have kicked in for them to pay like that $90,000.
Damn. Wow. Yeah. Now you explain it that way. Yeah, that's a tough existence.
It's a tough one.
Yeah.
It's crazy because, I mean, I understand the value of it because I'm like, so like if your parents have insurance, like they could put you on their plan, and then they, like Obama extended it to 26 because it used to be like once you're 18, you no longer have coverage. But with Obamacare, it was like, well, some people are still in college, people are in grad school, they don't have jobs. So they extended it to like you can still be on your parents' health insurance to the age of 26.
Obama, how can we ever thank you?
I mean...
So that was Obamacare was like a whole bunch of like, how do we make more people covered? So making it like, it's not that everyone who turns 18 is now open and has no insurance. Now, like at 26, hopefully you have a good job where now you've like have your employee sponsored coverage, and then you can afford the payments now.
You have some money at least to start off with.
Some money, right? Or at least some job that allows you an opportunity to like sign on for health insurance.
Oh wow! Thank you for shedding light on. Sense. Yeah, definitely. That's been very informative. I'm pretty sure the listeners would definitely appreciate that.
Yeah, but you do have to sign up every year. That's the problem. Like every year you have to, like, it's not something you have in that.
Oh, wow. So they're not even trying to make it easy for people.
Yeah. So even like for me, I have a job. Every year they send like a list. They send an email. Are there any changes to your healthcare coverage? Do you want to switch it? Are you happy with it? And then they usually automatically enrolls you if you don't say anything.
Okay.
But like if there's any changes to your household or anything like that, then that changes. And then like you can only enroll for health insurance. They have like an enrollment period. I think it's from October to January. So like that's the only time that you can get health care. If it's May.
Yo, what is wrong with people? I don't understand. Why is it so difficult? No wonder like so many people that just don't get insured because they either miss the deadline or they forget about it. Stuff gets lost in the mail or in your inbox and you just can't find or even remember to sign up. And you're just walking around thinking everything's covered, and then you realize when something unfortunately bad happens, boom, you're done. I see that a lot in women's healthcare. Like patients will come in and they're pregnant, and then you're like, your insurance has been deactivated. And they're just kind of like, wait, what? And they were like, did you re-enroll? And they're like, I didn't know I had to. There are things that like trigger, like that you can do outside. Like let's say you lost your job or you become pregnant or lost your job, you quit your job or something like that.
then those exemptions out of that. So there are like little trigger things that will allow you outside of that enrollment period to enroll. But yeah, you have to know what they are.
Yeah, you definitely got to be on job with these insurance companies for sure.
Oh,
Said
yeah.
I wake up every morning, pray to God that I'm fixing up. Hope I'm never slipping up. Hear the money calling, need my peace to start getting up. Feeling like I'm blessed, but it came with a bit of luck. Feeling like you stressed, then the tension starts to fill you up. Need an intermission, yeah, they ain't the same lane as us. Come from different sticks, yeah, they're not the same range as us. They cop the pleas and top of teas, they're not hitting range with us.